Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Addison's disease, also known as adrenal insufficiency, is a rare disorder that occurs when the adrenal glands do not produce enough of certain hormones. These hormones, cortisol and aldosterone, play vital roles in regulating metabolism, blood pressure, and stress response. Cortisol, often called the stress hormone, helps the body respond to physical and emotional stress. It also helps regulate blood sugar levels, blood pressure, and inflammation. Aldosterone, on the other hand, helps maintain the balance of salt and water in the body, which is crucial for regulating blood pressure. When the adrenal glands are damaged, they cannot produce enough cortisol or aldosterone, leading to a range of symptoms that can be mild or severe. Addison's disease can be caused by several factors, the most common being an autoimmune disorder. In this case, the body's immune system mistakenly attacks and damages the adrenal glands, disrupting their ability to produce hormones. Other causes include infections, such as tuberculosis, which can damage the adrenal glands, and bleeding within the adrenal glands, which can disrupt their function. Certain medications, such as those used to treat fungal infections or cancer, can also damage the adrenal glands. In some cases, tumors in the adrenal glands or the pituitary gland can also lead to Addison's disease. The symptoms of Addison's disease often develop slowly and can be vague, making it difficult to diagnose in the early stages. Common symptoms include fatigue, muscle weakness, loss of appetite, and weight loss. Individuals with Addison's disease may also experience nausea, vomiting, diarrhea, and abdominal pain. Changes in skin pigmentation, such as darkening of the skin in certain areas, can also occur. Low blood pressure, dizziness, and fainting are also common symptoms, especially when standing up quickly. In severe cases, Addison's disease can lead to an Addisonian crisis, a life-threatening condition characterized by very low blood pressure, severe dehydration, and shock. Section 4. Diagnosing Addison's disease. Diagnosing Addison's disease involves, a combination of physical examination, medical history review, and laboratory tests. The doctor will ask about the patient's symptoms, medical history, and any medications they are taking. They will also perform a physical exam to check for signs of Addison's disease, such as low blood pressure, skin pigmentation changes, and muscle weakness. Blood tests are essential to measure the levels of cortisol and other hormones produced by the adrenal glands. An ACTH stimulation test is often used to diagnose Addison's disease. This test measures the adrenal gland's response to ACTH, a hormone produced by the pituitary gland that stimulates cortisol production. Section 5. Preventing Addison's disease. Is it possible? Unfortunately, preventing Addison's disease is often not possible, especially when it is caused by an autoimmune disorder. There is no known way to prevent the body's immune system from attacking the adrenal glands. However, some measures can reduce the risk of developing Addison's disease or its complications. These include managing underlying medical conditions. If you have a medical condition that increases your risk of Addison's disease, such as tuberculosis, it's essential to manage it effectively to reduce the risk of adrenal gland damage. Avoiding unnecessary exposure to infections, taking precautions to avoid infections, such as practicing good hygiene and getting vaccinated, can help protect your adrenal glands. Seeking prompt medical attention for adrenal insufficiency symptoms. If you experience any symptoms of adrenal insufficiency, seek medical attention immediately. Early diagnosis and treatment can help prevent serious complications. Section 6. Treatment and management. Treatment for Addison's disease involves replacing the hormones that the adrenal glands are not producing in sufficient quantities. This typically involves taking daily medications, including corticosteroids like hydrocortisone or prednisone to replace cortisol, and mineralocorticoids like fludrocortisone acetate to replace aldosterone. It is crucial to follow the prescribed dosage and schedule carefully, as abruptly stopping these medications can lead to an adrenal crisis. In addition to medication, lifestyle modifications can help manage Addison's disease. These include Eating a balanced diet. A healthy diet, rich in fruits, vegetables, and whole grains, can help maintain overall health and well-being. Staying hydrated. Drinking plenty of fluids is essential, especially during physical activity or hot weather. Managing stress. Stress can worsen Addison's disease symptoms, so finding healthy ways to manage stress, such as exercise, yoga, or meditation, is crucial. Wearing a medical alert bracelet. Wearing a medical alert bracelet or necklace can help inform healthcare providers about your Addison's disease in case of an emergency. UMCC, your ultimate medical consultant connectors.